TFCC and Google do an image search, and you end up with Transformers Collection Club. What more do you want? It's
Transformers.
It's on. It's great.
That'll be an exam question, right?
Look at the exam question. What does TFCC stand for?
Transformers Collection Club.
Usually if it's funny, it's not the right answer.
That's
Okay, so it really stands for Triangular Fibrocartilage Complex. And main thing going on here is that you have the ostrocrutrium, the ulna radius, and then you have those ligaments that go right along these bones too, which is ulnar collateral, extensor carpi ulnaris, and the radial ulnar ligament, and that's what makes up that triangular fibrocartilage. Okay, so mechanism of injury is forced wrist hyperextension. You can get the piano key sign, which is similar to what I showed you guys in the clavicle. Kind of push on one part and then like another part pops up. Suspected injury should be casted 4 to 6 weeks. And you can either like tear that ligament completely, and then you can also have like the bony involvement with it as well. So if there's any fracture involved in that. Okay. So ulnar chondromalacia can happen, degeneration, impingement, calcification, bone will form to just try and heal itself, and in turn you'll get a lot of limited wrist range of motion, especially like ulnar deviation and radial deviation will be a lot of painful for these people. So cast them 6 to 8 weeks, and then removals. Polys fracture. This is the most common fracture of the radius that you can have. It's that distal part of the radius that just snaps. Seen a lot in younger athletes, like freshmen, sophomore. And I think mainly that's just due to the lack of bone formation. Because you don't see these a lot in college. So, but again, if you guys haven't caught on, really common mechanism to wrist AMCM injuries is push. So like what you do with every other fracture, rise, splint, rehab, you'll get an MRI or X-ray to confirm it, but go from there. There's also what's known as a Smith's fracture too, and that's just the opposite. So there you go. Fall like that.
See, that's when you fail to take a roll.
I've always thought that's funny because that's not an instinct of us to prove it, but in case that ever comes about. But right here, I'll show you that. This is a little bit of dislocation too. So right.
That's when you fall fabulous.
Like this.
You fall fabulous.
And then a lot of times, because this
trying to do
happens
Thriller.
in younger athletes, and we'll get into this during the next section too, but because this happens in younger athletes, we'll have a lot of open growth plates. So right here, it kind of looks like a dislocation, but that's just an open growth plate right there. That sometimes, like, I know ERs are notorious for misdiagnosing fractures or something for an open growth plate, so just keep that in mind. Carpal tunnel syndrome. You guys heard about this, I'm sure.
Mm-hmm.
So that transverse carpal ligament gets swollen or inflamed, and that causes pressure on that median nerve and the flexor tendons, so it's making it difficult for those flexor tendons to do their job, and will cause numbness, tingling, radiating pain into the fingers as well. Maybe you'll see this like in a tennis player or something, but usually this is like older people that happens from typing or
Yeah.
stuff like that.
The people.
Cool.
Repetitive stress could be due to recent other traumas such as tenosynovitis, flexor tendons, and then just like what I said earlier. So, okay, so you want to figure out what the source is. Are they having arthritis? What are they doing as their occupation? What are they doing on their free time? If they're doing any repetitive wrist flexion activities, that could be it. And then also any other previous injuries such as like a Colles fracture or ligament dislocation can also cause that as well. Even ganglion cyst. You guys ever seen a ganglion cyst?
Is this bad?
It's like just a big ball like right here pretty much. You
Is
have
it?
it right here, but they're very common in the wrist. Yeah.
I think I have one. I'm not sure.
How long has it been there?
Forever. I don't know.
You just.
I mean, there's some
That's-
pain
yeah,
associated
but-
with it.
Ganglion cysts are usually a little
They're
bit
bigger.
Well, they're a little bit like that's hard.
Did you try the bone, the slapping?
And they're usually lower. They're like right here.
You just.
So you can surgically have them fixed, which is one way to approach. They go and
Unless-
cut those things out. I had a friend who'd get them every now and then, and she'd take a book and just smash it. She's
Yeah.
like getting hurt like hell.
That's
But it
awesome.
wouldn't be a surgery. I wouldn't
Take a
have to
bump.
pay for it, and it would heal within a week. So, I'm like,
Should I smash this?
Where's that Ortho book? The thing where
yeah, you just need
Oh yeah. We're gonna fix it with the ortho book.
We actually asked one of our athletes last spring if he wanted to do that.
I'll slam it for you like that. Dude, I've always
So is
had.
that just-
surgery.
So it's just like bone?
What's up?
It's like.
That seems more like a bony formation. That was cyst.
Yeah.
You're just unique and special. I'm telling you.
is your
You get
physical
into eval and you'll find out all the weirdness of all your classmates. Because someone's gonna be like, yeah, check this out. And you'll find out they're like, their
I've
knee
always
bent
had
6
that.
different directions. They're all
But I didn't always have this.
There's for none.
You did.
So
Just be normal.
I realized that when I kept hitting myself on doorknobs.
It's
We
probably.
got some soul
That's probably
stuff in there.
ossification. Class.
Probably.
Don't talk about it.
Let's see it.
Wait, what? What?
She's so excited.
Yeah, let's see it. We want to see it.
Wait, what's
Right,
going on?
guys?
So what's sulcus sign, dude? You guys, we talked about that, but
It's like slack sign.
joint.
The sac sign up here, right?
AC. Isn't it?
Okay. Is it up here?
It's that area. It's linear.
Confident.
Remember when they pulled it?
Yeah,
Pulled
AC.
down, right?
Yeah, pull down, linear roll. It's
That-
nothing. It's nothing like the video that.
Kind of
I
threw
knew
me
it was
out.
gonna
It's
happen
good.
one day. That's cool.
Well, which one? Both of them or what? Oh, really?
Yeah.
Oh,
Wait, I
Jesus.
can't see that. What the heck?
It's pretty sweet.
There's some braces on.
Hey, pull me.
It's a good one. It's a good one. It's a good one. It'll come up and up or get up wrong.
I'll just tell Brent now.
Okay, so treatments for this are management, and
Oh.
you can get an injection, or you could do the surgery where they decompress that transverse ligament, and then unless the median nerve is otherwise damaged, you'll just have them rest and splint for 6 to 8 weeks. And they're told to have the splint on them all the time, too, so even when sleeping. UCL sprain, Bennett's fracture, Gordian tenosynovitis. All right, so, or whenever you sprain that UCL, also called gatekeeper's thumb, and that's just where you sprain that ulnar collateral ligament, usually from either like bending back like that is when it's usually going to happen. I see a lot of the times with football players, well, maybe they'll get like their jersey caught, or whenever they're blocking, they'll get it pulled back like
Indoor
that.
soccer. Or
And
into the wall.
liquids in it.
That's not-
So this is an example of the valgus test that you do for it. And you can see the laxity in that top picture. See how that, if you guys even like pull your thumb back, you have a lot of laxity, right? So, but it'll be to the point where that thumb gets pulled like all the way back. Oh, you've had that before?